Okay. So basically, all these different image modalities can be captured by their electromagnetic spectrum, right? So here is the EM spectrum. So basically, it's the range of all types of EM radiation, right? So here are some of the typical wavelengths, right, corresponding to first radio waves to the shortest one, the gamma rays, right? So the radio waves has a long wavelength that could maybe a couple of meters, 100 meters, can easily span like a football field, okay? And the shorter one after the radio waves, the microwaves, right? So we are using microwaves at home, right, to heat up the food. And we also have if we're going shorter wavelength range here, we have the infrared light, right? And then go to the the visible light spectrum, right? So with the red with 700 nanometers, that's the longest, and with the shortest 400 nanometers for the violet, right? And if we're going the even shorter wavelength, right? And we have the ultraviolet light. So, come from the sun, right? So if you expose, too much time at the ultraviolet light, then you have the risk of sunburn, or you increase the risk of skin cancer, right? And if we go even shorter, wavelengths, right? We have, higher frequency of the wave. We have X-rays, right? So it's able to, examine the internal structure of the human body, and we have the shortest wavelengths here is the corresponding to the gamma rays, right? So it arising from the radioactive decay of the atomic nuclei. Okay, so basically we have, if the longer wavelengths, then we have lower frequency, that means lower energy, right? If we have shorter wavelengths, they have higher frequency and has higher energy, right? So we all feel that, right? If you have exposed to ultraviolet sunlight, we got extreme heat, right? The sunburn. Okay. So the X-ray was discovered by the German physicist William Röntgen. So he actually won the first Nobel Prize in physics in 1901. So this is the first medical X-ray. So actually, this is the X-ray by his wife, Bertha's hand, right? So, and this is like the ring on the hand. So basically, the X-ray or radiography. So this is like the conventional radiography. Use a small dose of ionized radiation to produce images of the body's internal structures. So the different density of the various tissues in the body, all right, such as bones and soft tissues, will affect how much radiation is absorbed. So it will result the variation in the image, right? So for the bone, has very dense structure, so it will absorb more radiations than some of the soft tissue and water, right? It will appear white in the image. And the soft tissues, which is less dense, will allow more radiation to pass through and appear in shades of gray, okay? Air, being the least dense, will absorb the least radiation, appear black on the image, right? So, so you will see here, right? So we have the bones appear in this image. And this is the typical X-ray machines, right? So if you've been to the clinic and taking some of the X-rays, so this is the equipment you will see, right? So you can either take standing up, right? So against this wall bucky, right? So here's the X-ray generator, right? So you can stand in front of these robot keys. So basically, this is X-ray detector. So you can also maybe lie down on this table, right? So we have an X-ray generator, right? And emitting this kind of radiation, and also there's an X-ray detector under the table. So we'll collecting these radiation path through the body and generate the radiograph. Okay. So there are basically 5, basic densities. So one is air, the second is fat, and fluid and soft tissue combined as one, and bone and metal. Okay. So for the air, so the X-ray can completely pass through, so will show up as black on the image. And for the metal, right, so basically will absorb all these energies, right? So won't pass through the metals, it will show as bright white. So any of these in between will have, different shades of gray, okay? So here is an example image of this X-ray, right? So it shows these different densities, right? So here, the most bright region shows the metal, right? So in the center, and so the bone is very close to the metal, right? Although it's a little bit light, but still the bones have very dense structure, is able to absorb a lot of radiations, and also have the fat and the soft tissue, and for the air, right, can completely pass through, so have appear very dark in the image. And there's a lot of use case for X-rays, right? So here I list a couple of them. So first is the dental examination. So this is an example, right? So you take a dental X-ray. So especially for young kids, right? They have their maybe development of the wisdom tooth, right? So you can take the dental X-ray to check out the development progress. It also can examine the case, right? Or maybe see if you want to do some adjustment, right? See if there's enough space to do some of the adjustment of the tooth, and also can be applied to have surgical markers prior to some invasive procedures, right? So you can place using the text X-rays and have some surgical markers. And another use case is mammography. So it's a radiograph of the breast that is used for cancer detection and diagnosis. And it can also be used for orthopedic evaluations, right? So if you may have some muscular skeletal pain, so you may have to take some X-rays and to do some of the examination, okay? And X-ray can also be used for checks examination, right? So we want to do the the TB examination, right, to see if there's any disease, for your, or some abnormal conditions for the lung, okay? And X-rays can also be used for age estimation, right? So basically, this can be used in forensic. So this is concrete example, right, for this mammogram. So on the left, this is a benign case, right? So there's a non-cancerous. So these are all the normal tissues. And on the right, so unfortunately, this case, this is a malignant. So this is cancerous example, right? So the radiologist will, based on the X-ray, will look for areas of white, high density tissues and notice size and shape edge, right? So in this example, a lump of a tumor will show up as a focused white, area. And yeah, so these are the X-rays, of different parts, right? The wrist, hand, forearm, pelvis, and the elbow, right? We can do some orthopedic evaluation. And X-rays are also very commonly used for fractures detection, right? So in this example, we need to take multiple views of X-rays, because from a certain view, maybe the fracture is not show up in the X-ray, right? So actually on this particular view, right? So the bone fracture is visible here. Okay. And for the chest X-rays, the radiologist normally will search for some abnormal patterns, right? So, and will often report some of the specific patterns or informations or attributes, right? Such as size, dimension, volume, the description of the pattern, right? Location, interaction with nearby structures, the intensity distribution, shape, and etc. Right. But for this kind of abnormal pattern discovery, sometimes can be very difficult because of the noise, right? Maybe the image is not very clear to diagnose some of the abnormal pattern, and some of vessels can be seen as small nodules, right? And radiology may also miss some of the patterns, right? And patterns may not be diagnostic. And also the size estimation is often done manually in 2D. So all these difficulties, requires some of the computer algorithms, right, that can help improve the diagnosis, right? So actually for this course, we'll mostly focused on, image processing or computer vision technique or machine learning techniques to help, radiologists to do the diagnosis, right? We can develop AI algorithm to automatically compute some of the attribute, right? For example, the size, dimension, the location, right? We can do the localization, right? We can capture the shape, right? Maybe do the segmentation, etc. Or identify anomaly patterns, right? By training the AI algorithm. So I think there's a lot of potential to using the AI algorithm to help radiologists to do some diagnosis. So we've talked about a couple of use cases for X-rays. So can you think of other, use cases of X-rays? Maybe not in the medical domain. Yeah. So here, this is I think maybe the most common use case for X-ray outside medical imaging, right? So we all go through, airport, other public transportation require, security check, right? So we have to scan the luggage, to, potentially detect if there is any prohibited items in your luggage, right? So yeah, actually this is the figure I took from this paper. They developed this kind of security inspection X-ray benchmark for prohibit item discovery in some of the overlap images. Okay. Oil exploration. I'm not sure if X-ray will be used in oil discovery. I think those are like a seismic imaging, right? So I don't know how much this X-ray will, because you have to have a very deep penetration into the ground, right? But yeah, maybe it's worth to look into that. Yeah.